Fibromyalgia is a chronic rheumatic disease characterized by chronic, widespread musculoskeletal pain that affects the muscles, ligaments, and tendons, and is often associated with fatigue, chronic tiredness, cognitive problems, and sleep disorders. In the last video, which you can find by clicking above, we saw in detail what the initial signs and symptoms of fibromyalgia are. In this instead, we will see what some remedies are for the management and treatment of this pathology. Let's start by saying that to date, there is still no definitive cure for fibromyalgia, but thanks to some interventions, it is possible to reduce the pain and the most disabling symptoms, significantly improving the patient's quality of life. The treatment of fibromyalgia requires a multidisciplinary therapeutic approach based on a treatment program personalized for the specific needs of the patient. This involves different therapies, pharmacological and non-pharmacological, and a collaboration of multiple experts, such as the rheumatologist, the neurologist, and the psychologist. Non-pharmacological treatments. If you suffer from fibromyalgia, exercise is probably the last thing you feel like doing. However, scientific studies tell us that it is actually one of the most effective strategies to try to manage this chronic pain condition. In fact, according to international guidelines, physical activity is the treatment of first choice in the initial management of fibromyalgia, as it has been shown to significantly improve symptoms. For example, aerobic exercises such as walking, swimming, or cycling help reduce pain, stiffness, and tiredness in people with fibromyalgia. This is because movement stimulates the production of endorphins, the body's natural pain relievers, chemicals produced by the brain, capable of reducing pain. Strength and resistance exercises, on the other hand, that is, those exercises that involve lifting weights or using machines or elastic bands that provide resistance to movement, allow you to strengthen your muscles and tendons. Exercise in general reduces stress levels, improves mood, and sleep quality. Not only that, it also improves the functional capacity of the pain modulation system through the stimulation of those brain regions involved in pain inhibition, thus reducing their sensitivity to pain stimuli. Although exercise is recommended for those with fibromyalgia, the symptoms often make it difficult to practice it consistently enough to benefit from it. Increased musculoskeletal pain after performing physical movements forces patients to limit their activities, thus creating a vicious circle in which physical form progressively worsens and the ability to withstand effort inevitably decreases. For this reason, it is important to always contact a specialist so that he can advise you on the type of training best suited to you, as well as the frequency and intensity. A choice that must be made taking into consideration the patient's general state of health and the severity of the symptoms, as well as individual objectives and preferences. Pharmacological treatments. To alleviate the symptoms of fibromyalgia, in many cases, it is also necessary to resort to pharmacological treatment, which involves the administration of different classes of drugs. But what are they? Let's go see them. Muscle relaxant drugs. Muscle relaxant drugs, as the name itself suggests, are a group of drugs capable of relaxing the body's muscles, both the skeletal or voluntary one and the smooth or involuntary one. Thanks to their effect, they help reduce tension and muscle stiffness in fibromyalgia patients, consequently also reducing pain. Antiepileptic drugs. Antiepileptic or anticonvulsant drugs are drugs capable of modifying the levels of some neurotransmitters present in the brain that regulate brain electrical activity. They are widely used to treat chronic neuropathic pain and fibromyalgia, as they reduce neuronal hyperactivity and excessive transmission of pain signals. Antiepileptic in general are thought to reduce the neuron's ability to fire at high frequencies. This is because they increase the concentration of GABA in the brain, the most important inhibitory neurotransmitter of the central nervous system, thus exerting a calming and relaxing action on a general level. Analgesic drugs and non-steroidal anti-inflammatory drugs. Analgesic or painkillers are those drugs that are used to relieve pain without intervening on the causes that provoked it. Non-steroidal anti-inflammatory drugs, on the other hand, are a class of drugs with anti-inflammatory, analgesic, and antipyretic effects. However, it is important to remember that fibromyalgia is not considered an inflammatory condition, so the effectiveness of non-steroidal anti-inflammatory drugs may be limited to some cases. Although they are often used to treat pain, the role of these drugs in the management of fibromyalgia appears controversial. Antidepressant drugs. Selective serotonin reuptake inhibitors are a group of antidepressant drugs, which, as the name suggests, prevent the reabsorption of serotonin, thus increasing its time spent in the intersynaptic space. However, the use of antidepressant drugs is not limited only to the treatment of a wide variety of psychiatric disorders, such as depression, anxiety disorders, and post-traumatic stress disorder, but also for many other pathologies, including fibromyalgia. Serotonin reuptake inhibitors have been shown to be effective in reducing pain and improving sleep quality in some people. This is because the drugs increase the availability of serotonin in the brain, which we remember is the biological precursor of melatonin, the sleep hormone responsible for regulating the body's circadian rhythm. Remember that there is no universal drug therapy for the treatment of fibromyalgia. The effectiveness of drugs can vary greatly from person to person, so it is always necessary to consult a specialist in order to identify the combination of drugs best suited to your medical condition. Also, not to be overlooked are the psychological factors linked to the disease, which can lead to the inability to carry out all daily activities normally and to a decrease in work performance, as well as depressive symptoms and cognitive difficulties. For this reason, in addition to the pharmacological and non-pharmacological treatments we have just talked about, it is important to educate the patient on how to live with fibromyalgia. Cognitive behavioral therapy, for example, is a form of psychological therapy that can be particularly useful in helping the patient develop cognitive and behavioral strategies to better deal with the symptoms of the disease and improve, as much as possible, the quality of their life.